I have the pleasure of introducing Dr. Ken Gilman from just north of Nashville. What's the name of your town again, Ken?
Clarksville.
Clarksville, right where the Army base is.
That's correct.
So Fort Campbell, I believe. So then you've been in practice. You went to Logan in 1998. You graduated, is that correct?
Yes.
Okay, and you kind of wanted to own your own practice, and you looked around. You found one in Tennessee. You're originally from the Northeast, correct?
Yes.
Yep. So you found this one in Tennessee, and you opened up in 1999, correct?
Beginning of 99, correct.
Good. And you've been a chiropractic practice, pretty successful one. Between you and your associate, you've been doing about 300 visits a week?
Yeah, up until the coronavirus issue, that was our average.
Okay. So in November of 2019, you joined AMI.
That's right.
And you went through the holidays and you put all your legals in and everything else. And right about the beginning of March, you launched your medical services. And that was right at the same time as we launched the coronavirus. So how did that go? What kind of thoughts went through your head?
Man, I don't know that I felt any anxiety over it. I just knew it was going to be different, but I was already doing something I really didn't know how to do yet, right?
Right.
Learning the process. So I don't want to say it was easier, but it wasn't anything we weren't already planning to do because the whole thing was going to be new for us.
Right. And you also have already been through at least one economic crisis. 2008 was pretty scary, and you've weathered that. So, you know, I went through the same thing. I wasn't really scared either, although, you know, there was some concerns, but I guess because if you've been through these things before, there's never been anything quite like this. But 2008 didn't go away in a couple months, and this looks like it might go away in a couple months, although it's bigger reaching. 2008 was kind of scary. We did very well, by the way, in the 2008 crisis, just by giving calm to our employees and to our patients. So that's the same path I took. So tell me, what path did you take?
It was the same thing. It just, you know, this too shall pass.
Okay.
A good friend of mine, Dr. Mark Percival, we talked years ago. He had founded a company called Health Coach, wrote a book called Body by Design, Healthy by Choice.
Mm-hmm.
And I remember him saying something years ago where it was always choose fascination over frustration, right? Because just speaking the two words changes your physiology. I'm frustrated, mad, it's negative.
Yeah.
Or that's fascinating.
Yeah.
Your entire posture changes just for speaking the two words.
That's right.
In order to understand the difference between the two, you have to know that in order for something to be appropriately frustrating, you had to have some control over the situation. So
that's right.
If you screwed up, if you made a mistake, especially if you screwed up twice, by all means be frustrated. Everything else is so that's the choice, right?
We missed that. We lost your feed a little bit there, Ken.
Okay.
You said everything else, and then it cut out.
Oh, well, everything else is fascinating.
Oh, there you go. That makes sense. Yeah. So then you got hit with this fascinating pandemic.
Yeah.
And what did you do? Did you watch? You told me you watched the summit, right?
I did.
Tell me about that. What were your thoughts?
Once I got past the feeling of drinking from a fire hose, you know, we just had to pick a spot and start. What were the tools we already had that we could implement right away? We would already aligned with Zingit and Patient Pop, so we reached out to them, and they were fantastic for getting us set up with what we needed to send out and when, and how to get what part of our demographic lined up. So we sent out text message blasts, we sent out email blasts, we did Facebook posts. It took us a little while, but we got a YouTube channel set up so we could send links to emails for people that don't engage social media. And we just started hitting them with things like, look, this is a safe environment, letting them know that we've spread our schedule out so that no one's going to be sitting in the reception area. You know, instead of, on a clinic side, instead of scheduling on time, we started scheduling by room, right? And we have 9 treatment rooms. So we were able to accommodate people. They come in, they sign in, they go straight to their room, and they stay there till they get treated and they get out. And we don't have people running across each other except on a rare occasion.
Okay, good. So you let your patients know that that would be the environment, so it was okay for them to come in. The last speaker we had, I conveyed this to him as well. that goes a long way. And where we got that idea was Colleen and I fly all the time. And the last couple of flights we had is when this started happening. And I noticed something I'd never seen before ever. And the flight attendant cleaned the bathroom herself twice during the flight. And I realized, oh, they're actually cleaning this plane pretty good. And I figured it's safe to fly. And I never got coronavirus. So I figured that same message should be something that we should send out. We actually came up with this idea before the summit at the mastermind that we had in Reno, Nevada. We were with some of our top doctors and talking about what if this gets shut down and what are we going to do about it? And while we're there, we're in a ski resort, right? They shut the slopes.
Yeah.
So we were all working, so we weren't outside, but all of a sudden we noticed all these skiers inside the lodge. I'm like, they shut the slopes to concentrate all the skiers into the building to avoid the coronavirus. It didn't make sense. But we realized something was about to happen, so we started coming up with a plan for this. And Colleen and I decided to do this summit with our partners and just get as much information out there to get people to calm their employees down, calm themselves down, and calm their patients down. So tell me how it went when you started communicating. Did people show up?
Yeah, the first week after they started initialing the stay at home, of course, Tennessee kind of lagged behind, but our numbers were real low in the beginning.
Mm-hmm.
So we had it was more of a suggestion. It was a safer at home order as opposed to a stay at home order. So that first week after that all started to shut down, we didn't feel much change. The following week, we dropped to about 50%.
Got it. So you did have a decrease in your volume, but at the same time, you're launching this whole new line of services, your medical services. So how did that play in?
Well, the first thing that everybody started talking about was how all elective surgeries are shut down. Well, if you want to get sick, go into a surgical suite, right?
Right.
If you want to get sick, go where the sick people are, right? So not only are they being told they can't come, they don't want to go. They know what the risk is there. So I just started going through my patient base and thinking about all the people that I knew were either considering a knee replacement or a hip replacement or rotator cuff surgery or whatever it was. And I just started calling them. I picked up the phone, made a personal phone call. Hey, how you doing? I know your surgery's been canceled, but what's going on in your head? Are you comfortable? Everything okay? Is there anything we can do for you? And then I just let them talk.
And what happened?
They would get to a point where I just don't know what I'm going to do. And I said, well, just turns out we now have something that we can offer you to help you avoid that surgery altogether. And next thing you know, they're signing up, they're on Natalie's schedule, and they're getting the exam. We've set up, let me back up to the appointment visits. I have completely shut down my schedule for Tuesdays because all I do on Tuesdays is report of findings for regenerative medicine.
Okay.
So we're keeping those numbers even though I've taken a full day out of my schedule.
Right. That's awesome.
Yeah.
So you've had some sales, and I did see, one of our people from AMI sent out a whole bunch of success quotes from clients, and there was no names on them. But you were telling me the very first one was you. So tell me about that.
Yeah, that was fantastic. I was blown away by last Tuesday. So previous week, Natalie had, I think, 7 different regenerative medicine evaluations that she's done. She's doing them on Wednesdays and Thursdays, and all the report of findings are on Tuesdays. We're ready to do the injection that day, but if they need financing or set up a payment plan, or maybe they've had a steroid in the last 6 weeks, whatever it was, we've scheduled them out based on the safe time and the most productive time to do the treatment. By the end of Tuesday, we had sold $54,000 of regenerative medicine.
$54,000. Now compare that to your previous practice. What was that like?
300 to 320 patients a week. I think my best collection month was 68,000 prior to that.
And you had a $54,000 day last week.
Correct.
Now, you told me something yesterday when I talked to you on the phone about all these people in Kentucky. You're really close to the Kentucky border.
Yep.
You want to explain that?
So Kentucky shut down chiropractors.
The only state to do that.
And the Kentucky Senate last week had passed a bill to reopen chiropractors, and the governor vetoed it.
He obviously doesn't like chiropractors.
I'm sure there's a vendetta there somewhere.
Yeah. So tell me how that affected you.
Well, we're getting calls from the DCs that work just across the state line because their patients are calling them saying, I'm hurting. What do I do? So the Kentucky chiropractors are calling us and saying, can you take my patients? Absolutely, send them on.
So you actually found a source of new patients, not just that way, obviously through calling your old patients and getting them in for new services, but now you have other doctors who are in a state that's shut down sending you their patients.
Yes. And that relationship will linger on for a long, long time.
Yeah. How many new patients did you do last week?
Ooh, I think the final number was 14.
14 new ones. That's an excellent week in a lot of people's books without a coronavirus. In the middle of a coronavirus, you're actually growing back your practice. Maybe you lost 50 or 40% of your current base, but you're getting a new base that's growing right inside this whole thing.
Yeah, and our revenue's actually gone up. The way we do business is changing, but the end result is growing.
So some people would think, oh my God, I picked the worst time to integrate, but it's apparently turning out to be the best thing you've ever done.
Yeah. So, the partnership with Grant Cardone, of course, he's in your head. You can't help but keep him in your head. You can flick him off your shoulder, but he comes right back.
Right.
If you've read 10X, if you read Be Average or Be Obsessed or Be Average, it just stays with you all the time. But read it and then listen to his audiobook, because listening to him tell the story adds a whole new level of appreciation for what he's asking you and telling you to do.
Oh yeah. So that's all fantastic. How many staff do you have?
We are on a skeleton crew for sure, but we always have been. I have 3 staff members. One is a billing specialist, and one CXT. So I have a CTA that can do X-rays and the intake process, and then one straight CA. And I'm going to include my wife. She's not technically a staff, but she is quite capable and fills in every hole in this office that is not license specific.
That's awesome.
That's our whole squad.
Well, you also have a nurse practitioner and you have the other chiro.
Now,
So you're actually like running about 6 people total?
Yes.
Maybe 7 if you count you.
We've just brought on a marketing director.
Oh, okay.
Who's a friend of mine. He's a brilliant guy. He's done it he's set up gyms in different places where he would literally build the building and then fill it and then move on, build another one and fill it. And we started talking about the regenerative medicine and all that's coming and the things that we'll be capable to help people with. And he just got fired up about it.
Yeah. Well, you should know that at the University of Miami, they're doing a emergency use application. I believe they're using Predictive's product on people with COVID-19. And every time that study's been done in China, in Israel, and in the United States already, 100% of the people who get the IV of stem cells from Wharton's jelly, the Predictive product, and we're talking about the core site product, it's the only one with live stem cells, 100% of the people resolved in less than a week. And they're doing it on critically ill people that have not responded, that are on ventilators, and it's turning them right around. So that's going to be huge news for us using those products in the future. It's going to catch the attention of America for sure, because it's the most successful treatment.
We've been sharing that buzz with our patients already as far as the wellness injections goes, whether it's IV or IM.
Yeah.
But we're doing our best as that information trickles in about what they're doing to treat COVID or anything else, we're slamming it right back out. It's constant. Go ahead.
I was going to say, that's awesome that you're doing that. Is some of this information coming from the Daily Alert? Has that been helpful for you and your staff?
Oh, absolutely. Absolutely.
Okay. Has your staff been listening?
I very rarely catch them live because I'm still in clinic, still seeing patients. But
right.
We appreciate the replay.
Yeah. We do that because 85% of our clients are still open.
Yeah.
Yeah. So, and this is the second interview today that is telling us they've actually grown financially during this crisis. And you're not taking advantage of anybody. You're just filling a gap in the service that's there. People are hurting. They got to go somewhere. That it's important to remember the number one burden on our emergency care system is chronic degenerative arthritis, specifically back and neck pain. And if you stayed open in this whole crisis, which you have, you're actually taking a burden off of our system.
Yeah, well, and we're taking on patients that never would have come to us for certain things. 2 weeks ago, I had a patient call me, said, I fell off a ladder. I think I broke my shoulder. In the past, he'd have gone to the ER. But on that phone call, he's like, I'm not going to the ER. No way.
Right.
come on down, man. We'll check it out. We took some
Did
x-rays, examined him. He had separated his shoulder. It was not fractured, so we were able to treat it.
Wow, there you go. So what do you see for the future? Where do you go from here?
Oh, man. Nowhere but up.
Well, that's a great attitude to have in the middle of this crisis.
Well, I put out word Friday morning. We're going to start interviewing. I need more help.
Good. Well, you know, you're right in the same ballpark as Lowe's and Home Depot. They are packed.
Yeah.
Which probably
well, the funny part there is there's a Lowe's right at my back door. Like, people can't go to Lowe's without driving past my building.
Really? That's pretty good pick. So
huge.
You told me one other thing I want to touch on before we go is you said you listening to our summit inspired you and some other AMI doctors to do something. You want to touch on that? Yeah,
absolutely. And that's stay connected. Right? We need to inspire each other. You know, especially now we're being told to stay apart. We're humans. We have to have interaction with each other. It's not the same because it's electronic, because we're doing it through a video. It's not the same as being face-to-face or in person, but it's way better than disconnecting.
Yeah.
By any means. So I reached out to, I think, 6 of our AMI colleagues, guys and clinics that are at the same pace or about the same place I am, started when I did or around that time. And we just created a text message group and encouraged everybody just to share your wins.
And is it working?
Absolutely. Absolutely. It's all inspiration.
Good, good. Well, I'm proud of you and honored to have you on our team because you're exactly who we were trying to reach, the type of doctor that would look up and see the responsibility in the healthcare system and take hold of that responsibility and help to change healthcare, which you're doing. And I think, you know, if you look at this COVID-19, yeah, is it the worst thing that ever happened? Yeah, but it could also be the best thing that ever happened to our type of practice because people are starting to realize here's a disease with no cure. The only thing you do is empower your body, which is our philosophy. Improve the function of the body, you can resist anything. So, well done.
Our mantra from the beginning. Yeah, the only tool we have for this is our own immune system.
That's right. That's right. Well done. Keep up the good work. And I'm sure we're going to be hearing a lot more from you in the very near future. So thank you for being part of this today and helping others to hear what you've done.
I appreciate the invite, Mike. Thank you.
You're welcome.